Okay, so we are going to start as soon as we get the notification that we are recording, and there we go. So good morning, everyone. This is Commissioner Dave Yamamoto. Today is Tuesday, April 12th, 2022, and we'll call this meeting to order this morning at 8 a.m. sharp. Before we get started, I'd like to remind everyone to please mute your phones. You can do this by pressing *6. Please unmute yourself when called to speak, again pressing *6. It is very important for all others to remain muted. Thank you. So I want to welcome everyone to this Board of Commissioners meeting. I do want to announce today is going to be a very short meeting. Matter of fact, I am sitting at the Sheriff's Office ATV Work Center. We are starting budget hearings today, and we're going through tomorrow, and we're going through Thursday. So it's going to be a very, very busy couple of days. We've got Mike Scott from Manzanita, who is one of our budget committee members, and he is, as we speak, probably driving here. Doug Olson from South County is also on the budget committee, and I'm sure he is probably on his way also. So we're going to be very limited in our reports today. But again, I do want to welcome everyone. I am looking at Commissioner Erin Skar. She is here in the room. Commissioner Bell, are you with us this morning?
I am. Good morning.
Good morning. So we're going to start. And so again, very abbreviated schedule, but we want to hear from Adventist Health and Tillamook County Community Health Center. But again, as you'll recall from last Tuesday, there was a question presented by Representative Gumberg about the apparently higher per capita death rate on COVID during the past couple of years. That could be a rather long, involved conversation. I know everyone is prepared for that question this morning, but I want to put that off if we can until next week. I think we do have some other COVID-related issues to talk about today, however. If you look across the country, COVID cases are increasing. If you look across this nation, COVID cases are increasing. I believe I heard this morning that the city of Philadelphia has reinstituted a mask mandate. So again, I would just love our health professionals here to just address how you see what's happening, especially in Oregon, with COVID cases, and we'll take it from there. And we will have plenty of time for Adventist Health, for the Tillamook County Community Health Center, and for the members of our Coastal Caucus who are on with us this morning. So as we do every morning, let's go ahead and start with Adventist Health Tillamook. Eric Swanson. Eric, are you with us?
I am. Good morning, Commissioner.
Good morning.
Our hospital census today is 13 with one brand new baby. We have less than 3 COVID patients admitted today. 7 surgery cases are scheduled. Ambulance had a really busy day yesterday, 17 911 transports, which is the highest number that I can remember in quite a while. 1 transfer to Portland, no transfers home. Across Oregon, the number of patients hospitalized with COVID-19 is 100, 5 more than yesterday, and there are 21 COVID-19 patients in intensive care unit beds, which is 1 fewer than yesterday. 5 of those are on ventilators. A new metric that I'm kind of watching, which I think is good for us for surveillance purposes. Yesterday, across Oregon, there were 3,786 emergency department visits. 1.6% of those were for COVID-like illnesses. And if we go back and look at the peak back in, let's say, March, we're looking at like more than 3% of those ED visits for COVID-like illness. So I think it's a good surveillance tool. 92 available adult ICU beds across Oregon. That's 14% availability. In the region, we have 42 available, which is 12% availability. 410 available adult non-ICU beds, which is 10% availability for the state. In the region, we have 110 available, which is 6% availability. Looking at Dr. Peter Graven's forecast from last week from OHSU, he's showing that there's a slight, the primary forecast shows a slight increase in hospitalized patients as the impact of the BA.2 variant and reduced COVID restrictions are experienced. This increase appears to be beginning in the Northeast and will be expected in Oregon as well. He's predicting a peak of hospitalizations of 220 on June 10th. So that's a little more than double what we have in hospitals this morning. As of April 8th, 99 patients were in Oregon hospitals, which is down by 58 patients over 2 weeks. The Northeast is seeing a consistent case increase, though hospitalizations only rose in the state of Vermont, which I thought was an interesting data point. Cases and the number of people in Oregon hospitals remain low. The BA2 variant, Omicron variant, is the dominant one in Oregon right now. We only have 5 children hospitalized with COVID. COVID deaths per day are expected to remain low over the next 3 months. And then, of course, flu cases remain low in Oregon, but he reports that Denmark is seeing a surprising increase, and South America is also seeing an increase in flu cases. So he expects that infections will rise moderately and lead to increased hospitalized population for more than 2 to 3 times more than current for flu. So there you have it. Unless you have questions, I'll go back on mute.
Thank you, Eric. Appreciate that. Any questions for Eric? Eric Swanson? And Eric, I know you have a call at 8:30. Is that correct?
Yes, that's correct.
So tell you what, if the Coastal Caucus doesn't mind, I would love to bring the Tillamook County Community Health Center online now to have a quick discussion about what they are seeing, and then maybe we can ask questions of both Adventist Health and the Tillamook County Community Health Center. So I know we have Representative Gomberg and Representative Weber on board. Are you okay with me making this quick change?
Let's go for it.
Thank you so much. I do appreciate that. So let's move then to the Tillamook Community Health Center. Hopefully we have either or Marlene Putman and or Ed Colson. Good morning.
Yes, good morning there, Commissioner. This is Ed
Good
Colson
morning.
here with the Health Department.
Yes.
So just our community update and just a real quick statement. I know we'll have a further conversation about Representative Gomberg's article in question, but we did want to start off just kind of addressing that COVID-19 related death rating from that article in the Oregon Capitol Chronicle that was brought to light last week. So we spoke with our health department COVID-19 response team, and it's hard to dispute the rating. Tillamook County was significantly impacted by COVID-19 related deaths during the Delta surge. We had 16 COVID-19 related deaths that occurred in August, and then another 16 that happened in September, which is nearly half of the pandemic total of COVID-19 related deaths for Tillamook County. 97% of COVID-19 related deaths in Tillamook County occurred in individuals who had underlying health conditions. 75% were above the age 60 and 97% were not vaccinated. And so just as a reminder from OHA, in Oregon, a death that's reported as a COVID-19 related death is one that the death is of a confirmed or probable COVID-19 case within 60 days of the earliest available date among exposure to a confirmed case, onset of symptoms, or a data specimen collection for the first positive test, or the death result from any cause in a hospitalized person during admission or in the 60 days following discharge, and a COVID-19 positive laboratory diagnostic test at any time since 14 days prior to hospitalization. And lastly, or it's a death is of someone with a COVID-19 specific ICD-10 code listed as a primary or contributing cause of death on a death certificate, regardless of dates of diagnosis or death. So with that being the case, we really want to let everyone know that we do grieve for every life that is lost during this pandemic and encourage all who remain unvaccinated to talk to a trusted healthcare professional, such as a healthcare provider, nurse, or pharmacist about vaccinations. So moving on from that, we're going to talk about our county data, which we had 5 cases over the weekend from April 8th through the 10th. Our 7-day case count from the 3rd through the 9th of April was 14. Our 14-day case count from the 27th through the 9th was 23. Total cases for April have been 18 in the first 10 days. And then total cases to date from the pandemic is 3,667. Now, total COVID-19 related deaths, we had 3 additional COVID-19 related deaths that have been reported. One was from February and 2 from March. That brings our death total now to 64, and we do have a news release about that on our website, tillamookchc.org. Our hospitalizations are at 143. Our active outbreaks, we currently have 0, but public health is monitoring 12 for potential outbreaks. Our vaccine update as of the 4th is of those aged 18 years old and older living in Tillamook County, 80.7% have initiated COVID-19 vaccination and have received at least one dose. 74.5% have completed the primary series, and then 44.3% have received an extra dose of COVID-19 vaccine in additional to their primary series. Staying informed about COVID-19 cases in our community is essential for navigating this next phase of the pandemic. So we have 3 useful tools. You could visit the CDC's COVID-19 community level tool to help you decide what prevention measures to take based on the latest data. Every county in the U.S. is classified into either low, medium, or high based on hospital beds being used, hospital admission, and COVID-19 case rates. You can also visit OHA's COVID-19 page to view Oregon COVID-19 community transmission dashboard, and that tracks the spread of disease in Oregon counties. The dashboard shows the level of community transmission by considering the COVID-19 cases, which is the number of new cases in the last 7 days per 100,000 people, and test positivity, which is how many came back positive in the past 7 days in the previous week. Or you can visit our website, tillamookchc.org, to see the weekend, 7-day, 14-day, and monthly total case counts, as well as our vaccination rates. So for vaccinations and testing, they are available at our most healthcare offices here in Tillamook County, as well as at our main clinic on Pacific Avenue in Tillamook. Please give us a call, 503-842-3900 to schedule. An additional booster dose for people 50 years and older, and people 12 and older who have moderately to severely compromised immune systems, who received their previous booster dose of Pfizer, Moderna, or Johnson & Johnson at least 4 months ago can now be received from our county providers. Let's see. COVID-19 vaccines are the best method for prevention, reducing disease spread and severity. But if you do have a positive test, we do have treatment options available, which include antiviral oral medication. Some of these treatment options do need to be started as early as 5 days from the date of a positive test. So please contact your provider or pharmacist as soon as possible. You can give us a call, tillamookchc.org, or calling 211 for information on COVID-19 testing, treatment, care, and vaccines. Or you can have a call with our public health nurse at 503-842-3940 if you need additional support. So that'll be our update there, and I'd be happy to answer questions.
For that, Ed, I appreciate it very much. So do we have any questions for either Ed Colson or Eric Swanson? And so I'm going to start here. So we're seeing an uptick in this country of COVID-related cases. And yet I think, and I'm just relaying to you what I'm hearing on the news, there's really not an uptick in hospitalizations and things of that nature. Ed and or Eric, any thoughts on what's happening here?
Well, Commissioner, again, what I'm taking a look at this morning is Dr. Graven's report that he's saying that if we're looking at what the Northeast is doing, he's saying that we've got an uptick in cases in the Northeast, but not, Vermont was the only state that he indicated had an uptick in the hospitalizations. So again, I'm not a epidemiologist, and I don't understand necessarily completely how variants work, but it appears to me that the current variant is not as doesn't make you as sick as like when we had the Delta, which is a good thing for us. We don't want people hospitalized or dying of this disease. And what I will do for next week's, I'm going to see if Dr. Bowman, our Chief Medical Officer, can be on our call next week to answer some questions that are more medical specific, where he's got some expertise.
Thank you, Eric. That would be very helpful. That's super. Ed, any comments on this?
Yeah, so we're following and alongside with what OHA is observing too. We do know that there usually is a lag whenever we start to notice that there cases start to increase on the East Coast. There tends to be a lag there. We're monitoring it and working alongside Oregon Health Authority. And we just, at the same time, as we see it on the horizon there, we do encourage everyone to, if they haven't been vaccinated yet, to get your vaccination. And if you are not feeling well or are sick, to stay home and continue those precautions that we started at the beginning of the pandemic. If people are starting to feel ill or so. But as more information comes about, we'll do the same thing and let the community know as we start to get more concrete information if we start to see surges within Oregon.
Thank you for that. Do we have any other questions for either Eric Swanson or Ed Colson? Hearing none. Gentlemen, thank you so much for being here this morning. Let's go directly to the Coastal Caucus. So I know, again, I saw Representative Gomberg and Representative Weber, and I don't know if we have either of our senators online, but who would like to start?
Well, commissioners, I'll go ahead and jump in. Good morning, everyone. David Gomberg here. Let me say that I really appreciate the attention everybody is giving to the question of concern that I raised last week, and I'm certainly pleased to hold that over for a few more days so that we have time to discuss it in depth. I just want to make sure everybody understands the question that I am asking. And I'll start by saying that I understand that there is an ongoing discussion about the process we use for identifying COVID-related fatalities. And not everybody agrees on whether or not that process or those definitions are entirely accurate. But the article that I referenced is at least purporting to compare apples to apples, that is to say, to use the same standard in measuring counties across Oregon for their fatality rates. And the question that I brought forward is, according to this report, that the number of COVID-related fatalities in Tillamook County was roughly twice the rate that we were seeing in neighboring counties of Lincoln or Clatsop. And so my question is, first of all, are we indeed comparing apples to apples? And if we are, then why are the circumstances dramatically different in Tillamook County? What are we doing differently? Are those fatalities perhaps clustered in particular parts of the county or particular industries in the county? I'm just trying to get a little bit better understanding of these numbers in the situation, because of course we come together every Tuesday morning, we run through the circumstances that we're experiencing within the county, but don't often have a larger context to compare how we might be faring compared to other parts of the state. And yes, every single fatality is most unfortunate, and we care about every single person that's affected. But I'd like to get a little better sense of the big picture. That being said, let's hold this conversation for next week. The only other thing I wanted to share with you very briefly is that Oregon State Parks has agreed to extend the comment period for new rules they are considering on the use of drones in public spaces, which would particularly affect the ocean shore, our beaches, and of course our state parks.
Market.
And the proposal before us right now is that that drones would be allowed everywhere except where they are specifically prohibited. And so if people have comments about that, they can send a letter, they can send an email, or they can go to the state parks webpage to list their thoughts or concerns. I'll remind everybody that parks can control what happens on the ground, but what those drones do once they lift off is no longer the purview of Oregon State Parks. It becomes the responsibility of the Federal Aviation Administration. And so it's a whole different situation once they take off. We're simply having conversations about where they can take off from and how that impacts safety, privacy, and wildlife. So I'll stop there because I know we're short on time. I think that that Representative Weber and her dog are with us this morning, and I'll turn the the time over to her.
Thank you, Representative Gomberg.
Thank
Representative
you.
Weber.
I
there
apologize.
you are.
Martin seems to get he has to say something every morning. I'm sorry. I will keep this short. On Saturday night, I was invited to the Tillamook Volunteer Fire Department's annual banquet and award ceremony. And I think that they had so many impactful awards granted that night that it was very rewarding to see how active our fire department is. And I wanted to acknowledge one person especially, and that's Tom Miller. And Tom Miller was given his 60-year pin, 60 years of continuous service, active duty to the Tillamook Fire Department. And I really think that that needs to be acknowledged. He started when he was 17, and he is still going to fires. Other than that, I want to wish everyone a happy Easter. Passover begins Friday. Be safe. They're finding that cell phone related accidents are on an uptick, so please be careful when you're driving. So that's my report for today.
Thank you to Representative Gomberg and to Representative Weber. Do we have either of our two senators with us this morning?
Senator Anderson was not able to join us this morning. I spoke with him last night.
Thank you, Suzanne. I do appreciate that so much. We were going to ask the sheriff's office if they had anything. Sheriff Brown mentioned that he would not be able to be with us this morning, although I'm going to put him on the spot. I see that Matt Kelly, our undersheriff, is with us. Matt, do you have any reports you want to give from the sheriff's office?
Hi, Doc. This morning, good morning, Commissioner.
Good morning.
Was up responding to a crash now. So with the winter weather, everybody just remind everybody to drive careful. It's still slick out there. We're not done with winter yet.
No, I agree with that. And they're possibly predicting a little bit more snow maybe tomorrow morning. So hang on, everybody. This is going to be interesting. Yes. So with that, again, because we're starting budget hearings today, we're going to call this the end of our community update this morning. I hope nobody minds. We've got a lot of things on our plate over the next 3 days. So with that, again, I want to thank KTIL especially for broadcasting and everyone for attending. Please don't forget next Tuesday, a week from today, starting at 8 a.m., we'll be back to this. And at that point, barring any catastrophes, we should have a full meeting. So with that, again, time being 8:23 a.m., I want to thank everyone and wish you a great day. Thank you.